Hello everyone. We have this module 1 of integrative medicine, which is called as evolution of integrative medicine. The module 1 will have 3 sessions, uh, which are titled as session 1, disease demography, session 2, components of integrative medicine and its medical compatibility, session 3, the very practice and education of integrative medicine. Let's look at session 1, disease demography. In this session, we shall look at the categories of diseases that led to the emergence of traditional medicine in dealing with non-communicable diseases, otherwise referred to as NCDs. The categories of diseases that we would look at are communicable diseases, and then class of diseases called somatic and psychiatric diseases. And then in recent times, a third category emerges called psychosomatic diseases, otherwise referred to as stress-related, lifestyle-related diseases. It is this category and its increased incidence that led to the emergence of traditional medicine as a choice and a component of integration in dealing with non-communicable diseases. Until 16th century, most cultures and civilizations evolved, practiced and perfected medicine, and commonly these are referred to as traditional medicine. But then there came centuries of wars and infection. It is the incidence and the intensity of the infection across the countries, affecting large number of people, bothered the then scientists and led their interest to biology. Biology here is very primitive, understanding human structure, human physiology, and also to that extent of understanding the cause of diseases. That's where people understood that there are certain microbes that led or caused these infectious diseases. It is also interesting that they discovered that some of these diseases are infectious, that it can spread from one person to the other. And that made it easy to understand that there could be a microbe that is moving from one person to the other, causing infection. Understanding these microbes causing specific disorder and understanding more and more the characteristics of these microbes led to the idea of wanting to discover an antidote, later referred to as antibiotics. It is the emergence of new discipline from science called biology that led to the understanding of human body and microbes and the prevailing diseases that made it easy for emergence of another discipline called pharmacology, where people looked at use of chemicals or drugs as an antidote to these microbes that were causing infectious diseases. So there came a combination of 3 new disciplines, that is biology, pharmacology and medicine, as an answer to this new class of diseases, probably that were there well before 15th, 16th century, but addressed very indirectly by herbal molds, later became easy to deal with the advent of pharmacology or drugs or antibiotics. So then the modern medicine, or the medicine that is referred to as modern medicine, took center stage in treating most of human disorders, not necessarily the infectious diseases, in effect replacing traditional medicine across the world. With the advances in biology and pharmacology, medicine witnessed a rapid progress in diagnosis and treatment of somatic and psychiatric diseases. And this progress established 2 approaches, that is pharmacological and surgical approaches, in treating somatic and psychiatric diseases. It is with this stable healthcare and the progress in science led to industrialization across Europe and North America. As humans engaged in science and technology-led industrialized occupations, there emerged 2 social and psychological issues. One, mental stress, and the lifestyle choices. It is these 2 factors that determined a new category of diseases which is now referred to as psychosomatic diseases, where psyche is mind and soma is body. In effect, diseases caused by the mind had definite impact on body, and hence most bodily disorders then started to have or understood to have mind or behavioral causes. These factors came into being by industrialized affluent living, where mental stress and lifestyle choices became the factors that caused bodily disorders. Mental stress is often managed poorly in daily life. So it is this emotional and mental disturbances is understood increasingly to have somatic signatures. While this is one major factor which underlies this new class of diseases, the affluent society also chose increasingly to have less and less physical activity. So the sedentary lifestyle and no physical activity led to bad or unhealthy lifestyle choices, leading to somatic diseases. The third factor, which is also the result of industrialized affluent society, is nutrition. Societies across the world moved from malnutrition to hypernutrition, where people chose high fat, high sugar, high salt diet, and these are referred to as junk food. And there are junk food both in the East and Western societies. So together, the mental stress, the lifestyle choices, and nutrition led to the three important factors causing somatic diseases, which is why psychosomatic disease then started to be referred as stress related and also as lifestyle related. But while these characterizations were emerging, medicine continued to look at this class of disease as simply non-communicable disease. It is those diseases that are not communicable, in other words, not something that can be spread from one person to the other. So although these diseases are not characterized or factors are not understood sufficiently, it is this lacuna that is leading to understand these diseases in wider perspective, the way humans conduct. This is important not because that there is an interest in medicine or in pharmacology or even biology. This interest is classically driven by simply, as we saw in across centuries, that the incidence, the quantum of the impact of these diseases. It is said that 64% of human morbidity and mortality is due to this class of disease called non-communicable diseases, stress related, lifestyle related, and psychosomatic causes. So these three important factors, that is mind or stress or behavioral patterns, 2, the lifestyle choices, 3, nutrition, is something that needs to be addressed in dealing with psychosomatic diseases. It is this need that's bringing back traditional medicine into center stage, where traditional medicine champions understanding and dealing with mind, nutrition, and lifestyle. Modern medicine, while treating somatic, psychiatric, and in recent times, psychosomatic diseases, has positioned itself as curative, acute care, and also, very importantly, life-saving medicine. As we understood so far, that it is the incidence and the intensity of diseases, the emergence of non-communicable disease, as we understood, something to do with stress, lifestyle, and nutrition, is multifactorial and hence needs additional different approaches to that of what modern medicine is used to. While non-communicable diseases has these multi-factors in stress, lifestyle, and nutrition, it poses both challenges and opportunity. Opportunity in recognizing these factors and identifying them as risk factors. It is these risk factors that eventually lead to stress and lifestyle related diseases. Hence, if one takes care of these risk factors, these diseases are preventable. The challenge is that for those who are already afflicted by these diseases, they need to be managed for life. And there emerges a new class of care within the medicine, contrary to acute care, which is the domain of modern medicine, is chronic care. And that's where modern medicine or mainstream medicine falls short in offering solutions in managing non-communicable diseases in the template or setting of chronic care. Traditional medicine has always looked at humans as a whole and hence considered these factors that would cause stress, lifestyle related diseases, and hence becomes an option for treating non-communicable diseases. Traditional medicine also has always emphasized on prevention as opposed to curing these psychosomatic diseases. Hence, the therapeutic modalities within the traditional medicine lends itself to treat stress, lifestyle and nutrition and use these therapies and concepts and approaches in both preventing and managing non-communicable diseases effectively. In summary, session on disease demography, we covered the evolution of medicine responding to three distinct categories of diseases, starting from communicable diseases that actually triggered the evolution of modern medicine or the medicine that is curative, reactive, then the class of diseases that are referred to as somatic and psychiatric diseases, where largely the chemical processes and the chemicals are regarded as the solution for the diseases. And then finally, the newest category of diseases called psychosomatic diseases, where psyche is mind and soma is body. So it is this class where the mind has a role in organic processes of somatic diseases, and which is why these class of diseases are referred also as stress related, lifestyle related, and within the medical circles are largely referred to as non-communicable diseases. Section 2 on components of integrative medicine and their medical compatibilities, we shall talk about how traditional medicine has progressed from being alternate to modern medicine and then to become adjunct or complementary to modern medicine, and by virtue of recent medical evidences becoming a key element of integrative medicine.